Good afternoon. It's October 2021. My name is Dan Murphy. I'll be your host of this webinar today on Medicare and Medicare choices. My company is Murphy Wealth Management Group, and I'm joined by my associate, Seth Rivers. We're both certified financial planners. And we wanted to do this webinar because it's a hot topic and it's the time of year to kind of get into all this. So we hope you find the information is very enjoyable, and we hope that it will help you make some good decisions as well. So Seth, take it away.
All right, thanks for joining everyone as we get into this. So obviously we're talking about Medicare and managing healthcare expenses in retirement, what baby boomers need to know about Medicare and long-term care. Now we're going to talk about three key points here. The first one, if you do not enroll in Medicare on time, you're going to have to pay a monthly penalty, and that's a permanent penalty. Most people don't realize that. Another key point is if you do not get the right kind of private insurance to go with Medicare, you may end up paying too much in premiums or out-of-pocket costs. The third key point, if you do not plan for higher healthcare costs in retirement, you could eventually run out of money or not be able to get the exact type of care that you need. Our agenda in our first part, we're going to talk about Medicare enrollment. What is Medicare? Who needs to enroll in Medicare and when? How do you enroll in Medicare? In the second part, we're going to talk about how private insurance and Medicare work together. How much does Medicare cost? What does it cover? And more specifically, what does it not cover? And how does private insurance work alongside Medicare? And part three, planning for the higher healthcare costs. There's a couple of reasons why your healthcare expenses will be higher in the future. One of them is for inflation, but also most people, as they get older, they're going to need more services. Therefore, you have an increased need and the expenses will go up. Also, there's a big preconception there that Medicare covers long-term care. It does not. Typically, long-term care is actually covered by Medicaid, which is a needs-based service. So as you get into that, we're going to start with part one, Medicare enrollment.
Okay, thanks, Seth. Great job. It's important to talk about this time of year because right now we're coming up on open enrollment, and this is great. I mean, especially for people that are new to Medicare or perhaps are a few years away. Every year from October 15th to December 7th, it's the same dates every single year. You have an open enrollment period where you're going to be able to kind of get a do-over. So if you decided the year before that the plan you chose wasn't great, then you'll be able to go back in there and change it, do some research. You know, normally before COVID, they had all kinds of, meal specials. You could get a breakfast or a lunch at a favorite diner, and they have people coming from different companies trying to get you to use some of their plans, especially the Medicare Advantage plans, which we'll get into that too. But yeah, so open enrollment's coming up pretty soon. Very important to keep that in mind. Who pays for health care in the United States? Well, if you're before age 65, usually it's a group health insurance or some kind of retiree health insurance. Maybe you're retired from New York State or a company plan. COBRA, if you've maybe lost your job or retired without having retiree health insurance. Individual health insurance on other ends. If you're over 65, then Medicare becomes kind of the first payer, and it's great for the employer or for the private insurance company because they finally can get in the backseat of the car. Now Medicare becomes the primary driving force, and basically the other insurance pays a second. But be careful, employers that basically have more than 20 people working for them, generally speaking, you may not have to sign up for Medicare whatsoever if you're still working for a company that basically has 20 or more employees, if you're still working beyond it. What this means for you, unless you're covered by a plan that has 20 or more people, you've got to enroll by 65 years old. So we'll get into some of that. What if you don't enroll in Medicare on time? As Seth said before, you can pay late enrollment penalties, and these penalties never go away. We just had a case where somebody didn't sign up for it for up to 2.5 years, and so they had a 20% a penalty for the rest of their life now because of it. So be very careful with that. Your healthcare expenses may not be covered by insurance. Think about it from the insurance company standpoint. I mean, if you're still on a private insurance carrier because you didn't sign up for Medicare, now they can come back and say, wait a second, we were more than willing and ready to jump in the backseat of the car and let Medicare be the driver. Now you didn't sign up for it, so those covered expenses may be in jeopardy, and your private insurance options also may be limited too if you don't enroll in Medicare on time. So you have to be very careful with that. What is Medicare? Medicare is just a national health insurance program for people that are 65 and over, period. Don't get it confused with Medicaid. Most of it is, administered through or signed up through Social Security Administration. But for the most part, it's administered by CMS, but it's run through Social Security. Who's eligible? Everyone over 65 that's a U.S. citizen or a legal resident that's lived here continuously for 5 years or more. And then some people who are disabled who are under 65 can also get disability benefits. 4 parts of Medicare. Medicare Part A and B. Part A is hospitalization, and Part B is medical insurance through doctor's visits, x-rays, office visits, those kind of things. Those are typically provided directly from Medicare. When you start getting into Medicare Part C and D, Part C is more managed plan. We'll get into that. Typically, you'll choose your favorite insurance carrier that's in the local area, and they'll administer the plan for you. So you get everything under one roof: hospitalization, doctor visits, and prescriptions. For those who don't have a Medicare Advantage plan, typically, under Part D of Medicare, you'll have to get private insurance for your prescription drug coverage. So option 1 is typically, the original Medicare, which basically has A and B. You can add D through a private insurer through what we call a Medigap or Medicare supplemental insurance, and Seth will get into that in a little bit. Option 2, you choose a Medicare Advantage plan. You sign up for a plan through some of the local providers in this Mid-Hudson Valley area. Typically Caremount's a big group, so is HealthQuest, so is Premier. So you'd sign up through them. They administer the plan for you. You'd have Part A, Part B, and Part D through one plan. Less paperwork that way, but limitations we'll get into as well. How do you enroll in Medicare? If you're receiving Social Security when you turn 65, Medicare's Part A and B are automatic. You can decline if you don't want Part B, but for the most part, coverage is going to start first day of the month that you turn 65, and Part C and D are not automatic. So you've got to choose private insurer and proactively enroll for C or D. If you're not receiving Social Security when you turn 65, then you've got to sign up through SSA, Social Security Administration, during a Medicare enrollment period. And there's 3 different types of enrollment periods we'll go through today. The initial enrollment period is the most popular, but then we have special enrollment periods, and that's typically for people that are covered and continue to work beyond 65 when the employer's got more than 20 employees or greater. And then there's a general enrollment period if you mess up and kind of miss through there as well. We'll go through all 3 of those. So typically, if you look at the sign-up period for Medicare, generally it's a 7-month period. In the first 3 to 4 months, 3 months before you're 65, the month you turn 65, if you sign up during those months, you'll have no delay in services. If you sign up, basically, after that, because you can sign up until 3 months afterwards with no penalty, but your enrollment period might be a little bit changed, but you will not have a penalty in your premiums. Who signs up for Part A during the initial period? Almost everyone that turns 65 signs up for Medicare Part A. Of course, if you're working for a company that has 20 or more employees, which are considered to be a large group plan, you should really check with them and make sure that they would not want you to sign up for Medicare Part A, which is the hospitalization part, in order for their insurance company to kind of take a back seat. However, you don't want to sign up for Medicare Part A if you are actually working for a company that has more than 20 people, and you also have a high deductible health plan with a health savings account. Health savings accounts allow you to put money away on a before tax basis and pull the money out down the road for medical expenses. Once you're on Medicare, you can no longer put money into a health savings account. So you want to be careful of that if you control when that actually starts.
Yeah, that's a key point that Dan just made. We get a couple of questions a year, at least 2 or 3 of people that want to contribute to an HSA, but they can't because they're receiving Medicare benefits.
Yes. Part B, very similar. People who are not covered by an employer sponsored group plan with 20 or more people are generally going to sign up during this initial enroll period for Medicare Part B. Also, people that are not working, people that are self-employed. I'm self-employed, so I've got private health insurance for my family. It's well over $2,000 a month. I can't wait till Medicare kicks in for me. I'll be the first one, certainly, to sign up for it. It's going to save me a tremendous amount of money with not really much of a difference in coverage. In fact, it might be actually even better than what I have right now. So I can't wait. Employers that work for a company that is less than 20 employees. So people that are still working beyond 65. If you're working for a company that's less than employees like we do, then you still have to sign up for Medicare Part B. If you're on COBRA, if you're receiving retiree health benefits, or if you're employed by a company whose health plan is less comprehensive than what Medicare would actually offer. Just go back one, Seth.
Sure.
Who signs up for Medicare Part D during the initial period? People that have signed up for Parts A and B that also want prescription drug coverage, either now or in the future. You've got to sign up when you're first eligible, or you'll also face that late enrollment penalty for down the road purposes too. And there's 2 options for Part D. You can get a standalone prescription drug plan through a Medigap policy or in addition to one, or if you're actually taking Medicare Part C, which is the Medicare Advantage plans. A lot of the Medicare Advantage plans have drug coverage as part of it. So a couple different options there. Oh, special enrollment period. Special enrollment period is specifically for people that missed that 7-month period in the beginning because they're still working for a company that has more than 20 employees. Once that employment finally ends, let's say it's 67 years old, they're 67, and now you finally left the company, you have an 8-month period of time after you leave to contact Medicare and get Medicare started for yourself, Medicare Part B, that is, and still avoid a lifetime penalty. For Medicare Part D during special enrollment, funny, they're not the same, but they only give you 63 days to actually start Medicare Part D after your employment ends during this special enrollment period. Best time to enroll in Medicare to avoid the late enrollment penalties. Again, sign up during that initial or special enrollment period. To avoid the gaps in coverage, sign up before your current coverage ends. So if you don't sign up during one of those periods, you kind of have to go into what we call a general enrollment period, which is next. During this period of time, if you've missed, like the case before, where we met somebody that had missed a sign up for 2 years, didn't think that it applied to them. Generally speaking, you've got January 1st to March 31st to sign up for the general enrollment period. And even though you signed up during that 3-month period, your coverage still would not start until July 1st. So that could be very important. Okay, so again, 3 general enrollment periods. We have the initial period where most people sign up 3 months before their birthday, the month they turn 65, and 3 months afterwards. Special enrollment period generally is for someone who is not signed up during the initial enrollment period because they were working for a company that had more than 20 employees. Again, once they leave work, retire finally, then they have an 8-month period to sign up for Medicare Part B. And then Medicare Part D basically gives them 63 days. And then for those people who have really missed both those sign up periods, generally they're in the penalty phase and they only get a chance to sign up January 1st through March 31st, even though the coverage doesn't start till July 1st. And how you sign up for Medicare Part A and Part B is fairly simple. You know, you're going to do that right through Social Security, regardless of whether you're getting Social Security benefits or not. You still can go to ssa.gov and sign up for Medicare Part A and Part B when it's time. How do you sign up for Medicare Part D? You've got to make a couple decisions here. I guess the first thing you have to decide on is, are you going to go with the original Medicare plans, which give you Part A, B, and D, and then you're going to shop for a standalone prescription drug plan offered through a private insurer, or if you go the Medicare Advantage plan, then you're going to pick one of the carriers in the area, and basically you're going to be able to get A, B, and D directly through that Medicare Advantage plan. You want to apply for Part D through the private insurer or through Medicare at medicare.gov, or we've put the phone number on there for 1-800-Medicare to go through it as well. And we'll come back to that when we start talking about, you know, getting onto the sites. The sites are very good. If you go to medicare.gov in this area, they typically will ask you your zip code. You can kind of go through it, put in the information. They'll give you every option under the sun. They give you all the Medicare Advantage plans that you can go through, the names of the providers that are providing those plans, on top of other plans that are available as well through some of the plans that Seth will go over in a little bit.
All right, Part 2, Medicare and private insurance. So premiums are nearly half of the Medicare beneficiaries' out-of-pocket health spending. You can see we have kind of a breakdown between the services and the premiums here. This data is a little bit old as far as 2016, but the average out-of-pocket expense was around $5,500 for those that were receiving Medicare benefits. Now, what are those out-of-pocket costs that are paid by the Medicare beneficiaries? There's a couple components. One is the premiums. It's the Part B premium paid to Medicare. It's not really paid. It comes out of your Social Security check. They just kind of take it from you. Also, there's the private insurance premiums for the Part D drug plan, plus a Medigap policy or a Medicare Advantage plan. So one of the terms that you're going to hear Dan and I refer to constantly is a Medigap policy or Medicare Advantage. That really talks about the two differences between original Medicare and Medicare Advantage. And then there's other out-of-pocket costs like deductibles, portions of doctor's bills that were not paid by Medicare, or services not covered. As far as monthly premiums, if you worked 10 years in this country, or your spouse did, you won't have to pay any premium for Medicare Part A. If you worked less than that, so 30 to 39 quarters, it's $259 a month, or less than 30 quarters, it's $471 a month. As far as Part B is concerned, that $148 is taken directly out of your Social Security check. But also one of the things that we run into quite a bit is they make an adjustment to this based on how much income comes in based on your tax return. Then for Part D, that's paid to the private insurer, and that covers your drug prescription card. So this is what I just mentioned. I don't want to get too busy with the chart, but basically, as long as you're a couple and you make less than $176,000, your premium doesn't change. It's the $148 a month from Social Security. But if you're making 176 to 222, they're going to have an income related adjustment amount paid to Medicare coming directly out of your Social Security check for around $59.40, in addition to a $12.30 increase for the Part D plan. So you can see that your total B and D premiums jump from 188 to 260. As you go forward and make more and more money and have more and more money on the tax return, you can see how the B and D premiums continuously increase up to a maximum of $622 a month.
Yeah, so we've had this before happen. This is a common occurrence that Seth and I deal with all the time in dealing with clients. Medicare will typically send you a letter directly from Medicare beginning of the year, letting you know that you're subject to a IRMA calculation, which is income related adjustment to your Medicare premium. You do have the right to question that, to ask for relief. And what they'll do is, then maybe it was a special situation. Maybe you sold piece of property or a house or something that caused you to be for 1 year, perhaps in a higher amount, Medicare then can look at that and say, okay, if this is a 1 year option, then basically we can go ahead and bring you back down to the normal calculation without the IRMA adjustment, as long as it's not going to continue. So be careful. That's always something that we kind of caution people on. And I guess the other thing to mention as well is that when Medicare typically is looking at these income adjustments, they're looking at it from 2 years ago. So for example, in 2022, since we're so close to the beginning of the year, they're going to look at 2020's income that you had that year. So it doesn't matter what you made in 21. They're looking at it from 2 years ago. So be careful of that too, because that will, obviously be either plus or minus for you, but that's the income year that they're always a couple of years behind.
As far as deductibles, without any of the other supplemental policies, your deductible for Part A is going to be just under $1,500 at $1,484. Your deductible for Part B is going to be at $203. And this is the big one for your prescription drug plan. You're going to have $445 per year. Now, one thing to note with the $1,484 for Part A, that's per illness. So if you have one diagnosis and you have to go into the hospital multiple times, you only have to satisfy that one deductible. But let's say you get sick in January and then you have to be admitted to the hospital again in, let's say, November, and it's completely different diagnoses. Those would be two different deductibles that you'd have to satisfy. As far as coinsurance, for Part A, there's a coinsurance for days 61 through 90 of $371, and that goes up to $742 for days 91 through 150. The skilled nursing, they're going to pay $185, or the coinsurance is $185.50 for days 21 through 100. As far as assigned claims of Medicare approved rate, you'd be responsible in Part B for 20%. And the same thing for unassigned claims, it's 20% plus the balance of the actual charge up to an additional 15% of the approved charge. The reason these numbers are significant and why most people end up getting a Medigap policy or a Medicare Advantage plan is those two particular supplementals will help offset the cost of these coinsurance and the unassigned and assigned claims. Part D, coinsurance. Part D always stands for drugs, just an easy way to remember it. But under standard drug plan design, the beneficiary will pay a $445 deductible and then 25% of drug costs after the deductible has been paid. And then the small copayment once out-of-pocket spending has reached the $6,500. But, and this is key, drug plans vary wildly. Some will pay more, and it'll be important for you to find a plan that covers the drugs you take. One of the conversations that we'd had, and that Dan and I actually took a course on Medicare, this particular woman that was running the course shops around for her drug insurance and her co-insurance every year because she's on some very unique drugs. And depending on the plan, she can usually find a very, very affordable drug coverage plan. So that's why we're discussing it this time of the year, because this is the time that if you want to make a change to a more appropriate drug plan, that's going to be coming up in just over a week now. What Medicare covers? They cover the 100% of the first 60 days in the hospital. As far as medical services, they'll cover doctor visits, outpatient services, and 80% of the Medicare approved amount, and some preventative services such as flu shots and certain screenings. What Medicare does not cover, and I'm going to highlight this very first one, long-term care. It does not cover long-term care. It does not cover care delivered outside of the US. So many of our retirees that are doing a lot of traveling need to be aware of this, that Medicare will not cover their costs when they're abroad. It doesn't cover dental, vision. And this one's a stickler that I really don't like. It doesn't cover hearing aids. And what's sad about that is it prevents a number of people that need hearing aids. They'll just avoid getting them because they don't want to pay the cost, which personally, I wish that they would include that. It obviously doesn't include cosmetic surgery. It doesn't cover acupuncture or alternative care. It doesn't cover any amount over the Medicare approved amount. And it doesn't cover amounts not covered by deductibles and co-insurance. Now, this is kind of the key thing, what private insurance may cover in full or in part. They might cover, depending on what plan you get, all of the deductibles and the co-insurance amounts, such as the Part A, that $1,494 deductible, the hospital costs after 60 days, because there was the co-insurance and the co-payment. The 20% of the doctor bill that Medicare does not pay. It also could cover the charges over the Medicare approved limit. And that's key because that, in some cases, depending on the plan that you get, allows you to go to any doctor that accepts Medicare and your type of co-insurance or Medigap policy. You can also get your prescription drug plan. It may cover the deductible. The drug plans vary wildly between plan to plan, but most of the cost of certain drugs during the initial benefit period and catastrophic coverage period, but they might not cover the donut hole. Oops, sorry about that. There we go. Medigap policies. So the key with Medigap and Medicare Advantage is Medigap is you're using traditional long-term care, traditional Medicare. It's a private health insurance for individuals. It's sold through private companies, and it's a supplement to the original Medicare coverage in Part A and B. What's key to Medigap policies is there's certain federal state laws that protect you, specifically in dealing if you have a Medigap policy in one state and you have, let's say, a C or a G or an F or whatever that plan happens to be, it has to cover certain services regardless of where you get it. So that leads right into this. It's standardized Medigap policy. It's identified by most states by letters, although Massachusetts, Wisconsin, and Minnesota, they standardize their plans a little bit differently. It does not work with Medicare Advantage. You pay a monthly premium, and the costs vary by plan, company, and location. One of the key things, actually, let me go back one slide and talking about the cost varying. As far as Medigap coverage is concerned, the most that we really see people paying for the absolute Cadillac plan, depending on, this is not a quote, it's somewhere between $270 and $280 for the most expensive plan, and it can come down from there. As far as the different plans that are available, you used to be able to get the F plan here, which basically covered everything, including your Medicare Part B deductible. Usually the plan that we look, and it's a good option for most people, is this G plan here. The only thing that it doesn't cover is your Part B deductible. And as we showed you before, that's only around $203. So that deductible will be all that you're required to pay when you have this Medigap plan and you have traditional Medicare. Medicare Advantage plans, this is where it gets complicated. As much as you're dealing with one insurer, every plan is very different. There are options that are approved by Medicare. It's also called Medicare Part C, but they're run by private companies, and Medicare pays directly an amount for each member's care. You may have to use a certain network or certain doctors by the hospital. One nice thing about it is it does include the prescription drug plan. So it's basically one-stop shopping. It also may include benefits like vision and dental, and there may be cost sharing with benefits going forward. Now, this is key. You want to shop carefully for these private insurance. Medigap policies are standardized, but the premiums definitely change. Also, in certain Medigap policies, they may offer dental or vision. It depends on the state and the location, but it may also change with regards to the price. You want to choose the policy that offers the coverage that you need, A through N. You want to choose a reputable company. And you want to make sure that your healthcare provider processes the billing for the company that you choose. As far as the drug benefits plan, we talked about that before. You want to choose the plan that's offering the coverage you need. As I was speaking about that one woman, every year she would just find this particular prescription, whichever company offered it for the best rate, that's where she would go with. And Medicare Advantage vary considerably. You want to choose the plan offering and the coverage you need for the medications you take. Now, this is...
I guess the key thing I just want to mention there, Seth, before we move on, is just
Sure.
the fact that be careful with these Medicare Advantage plans, because they typically, if you wanted to get down to Sloan Kettering or some kind of a specialized hospital, you may have a difficult time using your Medicare Advantage plan when maybe the organization that you chose to have your Medicare Advantage plan through also has the same kind of services. And so that might be a limitation based on that. But Seth and I will go through some of the differences in the plans on the next slide.
Yeah, so this is kind of key. There's a lot of bullet points here, but people get confused by Medicare Advantage and Medigap and traditional Medicare. Typically, we look at the Medigap policies because they're more flexible, but there's a disadvantage once you get past a 1-year mark. You can see here at the bottom that if you signed up for a Medicare Advantage plan and within a year you decide you want to enroll in or switch back to the original Medicare with Medigap policy, you get 12 months as a free look. Once you're past that 12 months, private insurers and Medigap policies can discriminate for pre-existing conditions. They can't within that first 12 months. So for us, typically we look at getting into the Medigap policies because they cover pretty much every out-of-pocket expense that you may have. But we always want to make sure that people are aware that if you decide you didn't like your Medicare Advantage policy, it's not doing what it needs you to do. You have 12 months from when you sign up for that Medicare Advantage plan to be able to go back into a Medigap policy without them excluding you for pre-existing conditions.
And I think that's a key thing to point out that we try and point out to every single person when talking about Medicare is depending on your health, and that, I know that can change, but if you let's say have poor health to start with, joining as a 65-year-old Medicare enrollee for the first time, although you can look at some Medicare Advantage plans in our area and they're downright cheap. I mean, you can get some for $0. But basically, a Medigap policy is going to cost a lot more money, but you may be so much more further ahead down the road when it's covering so much more and giving you the ability to go where you want, whatever state you're in. That plan that you have, that Medigap policy that you have, is going to transfer over no matter where you are in this country.
All right, plan for higher healthcare costs in retirement. We're going to kick this back to Dan to get us going.
Okay, great. So great job, Seth. So, we're going to finish up with this last section here. So when you look at out-of-pocket expenses by gender and age, you can see very clearly if we're looking at, let's say, a male that's under 65 years old, you can see that the services barely outweigh what the premiums are. But as you get older and older, as you become, let's say, a male age 85 or a woman that's over age 85, you can see the services that you're getting far exceed the premiums that you're paying. But when you look at both of those together, out-of-pocket expenses plus the premiums you're paying itself, you could be paying $8,000 to $10,000 a year the older you get, depending on the services that you require. And we're going to go through that. Typical Medicare budget today is fairly simple. I mean, when clients ask us about this, Seth and I spend a lot of time on this. When you look at the cost, I mean, here's a good example. With someone with no income-related adjustment, they're going to have a $148.50 premium with Medicare Part B premium coming right out of your Social Security check. You're going to have a Medigap premium, which should be about $200, and that's for a G policy. So one of the best, if not the best, that's available today for people that weren't in F or H before, which I think those ones have stopped. But and then you've got your Plan D drug premium. So all in between A, B, and D, and the Medigap policy, you're less than $400 a month. Okay, and $148.50 of it, you're not even going to see it. It's coming out of your Social Security check, before you even get your check. So you're really laying out another $240 a month. And really, we talk about this all the time. It's good coverage. We've seen people with heart issues, cancer, very good coverage, and not a lot of money out of pocket above and beyond the $388.50 a month. But when you look at some of the other out-of-pocket costs, okay, the biggest expense is what we just kind of went over. That's $4,662 a year. But when you look at out-of-pocket costs for prescription drugs, on the average, $650 a year, plus dental out-of-pocket, vision out-of-pocket, and maybe some kind of alternative care out-of-pocket. So all in, you're looking at about $6,200 or $500 a month for your health care per person, right? So as a couple, you're talking about $1,000 a month for all this during the year. What can cause your healthcare budget to change in the future? Well, rise in healthcare costs lead to higher insurance premiums, higher out-of-pocket costs for services that are not covered by Medicare or Medigap, and a change in health status may require expensive prescription drugs, more services not covered by insurance, dental, vision, hearing, long-term care we'll get into, and alternative care. Planning for future healthcare costs. According to some of these organizations, Fidelity, for example, indicates that, during the lifetime, you're going to need somewhere, around $300,000 for couples during their lifetime, not including long-term care for related medical expenses. Employee Benefit Research Institute says 130 for men, 146 for women, 270 for couples. It's in the same ballpark. So it's not cheap, and certainly more and more people are living well into their 90s, and therefore that's where a lot of those expenses really reach. Planning for long-term care. Long-term care is not covered by Medicare Medigap, with one exception, as you can see below: skilled nursing care. So when we talk about skilled nursing care is typically not what we consider to be long-term care. That might be somebody that's going into a nursing home for a short-term stay. Maybe it turns into a long-term stay, but for the most part, starting off as a short-term stay, and they need maybe skilled care. Maybe they need some help with occupational therapy, physical therapy. In that case, Medicare pays 100% of the first 20 days and 80% of the next 80 days, bringing you to the end of that 100-day elimination period. Typically when we talk about long-term care, we're talking about help with activities of daily living. And in that case, there's no coverage at all. When you look at basically the percentage of people age 65 and over with a disability, and this is back from 2017, you've got 35% of people over 65 are going to have some kind of activity limitations as well. We're seeing that on a day-to-day basis. When you look at some of the causes of activity limitations, probably the biggest things are, arthritis, which again, I mean, that's nothing medical, but typically, that can really start to cause some serious issues with people having to either go into nursing homes or perhaps home health care or some kind of assisted living care. So between hypertension and arthritis, those are typically issues that are going to cause people the most issues over time. Don't need help now. Yeah, I mean, the younger you are, the better it is. But look at some of these cases now. Look at the category to the right, walking. My father-in-law is going through this right now. He's over 85 years old, perfect example, hasn't been able to walk the last several years because he's having some issues with pain in his legs. And because of that, he got into an issue medically, and now he's really having a hard time coming back from this. He's got to learn again how to walk, how to, balance himself. He's having some significant issues. So this is a situation when, as you get older, and if these things start to creep up, if you don't keep up with walking and moving around, then all these things start to compound and we start to have some serious issues. Help with the instrumental activities of daily living. So they call it IADLs. I used to call it just ADLs, activities of daily living. But typically when you look at the levels of care, in-home assistance is really for people that they need help with shopping, they need help with preparing food, chores, housework, managing their money, traveling, using the phone, responding to emergency alerts. I mean, that's a bare bones minimum where people can't get around a lot, like my father-in-law would require. But then you start getting into level 2, which is custodial care, right? You can't eat anymore, or you're having difficulty feeding yourself. You'll find that more with people with arthritis. Bathing, dressing, toileting, transferring, continence. I mean, there's 6 activities of daily living. And so you start to see that people that can perform 2 or 3 of these typically may end up in a nursing home if they don't have people that can help them with this, on that, in a home setting. They'll go to custodial care through a nursing home. And then level 3 is skilled nursing care. That's when we need 24-hour round-the-clock supervision ordered by a physician, disease management, rehabilitation, right? As I said before, physical therapy, occupational therapy, speech therapy. You'll typically need some kind of a skilled care. So those are the 3 levels. What are the costs of long-term care? I don't really like this slide, but we'll go through it anyway. I mean, typically, if you look at private, room in a nursing home, it's $290 a day. I mean, this is the cost around the country as of this year, and that's the United States median. We live in New York, in Dutchess County, for example. Some of these places are $400 to $500 or more per day for just a regular nursing home bed, semi-private, not even a private. And typically, that's over $15,000 per month. You can find some that are a little cheaper than that, but for the most part, you're looking at between $12,000 and $15,000 per month to stay in a nursing home. So why plan for long-term care? Well, obviously, you want to spare family members the burden of caring for you, avoid having to spend on assets and go on Medicaid, and be able to direct your own care. That's the most important thing, right? People want to be able to choose how they want to finish the rest of their life, right? And so no one wants to go into a nursing home. Sometimes people just have to, or they get to that point where they need just such care, so much of it, that there's no other alternative. But that's the key thing, is why planning for care is important, is because you want to be able to direct exactly how your own care is going to be, how the quality of life is going to be for you at the end, when you're finishing up, your lifespan.
Well, that reminds me, Dan and I were speaking with a client a couple of weeks ago, and this particular one was asking, because she knows she's going to end up in a nursing or assisted living facility, if she should go take a look at the facilities that are in her area, even though she's probably a number of years away from needing that kind of care. But you don't want to end up in a place that you don't like. So if you can have a choice in the matter, you want to be proactive about these things.
Yeah. And the other thing that I'll mention as well, staying on that same slide, is realistically, if you go into a nursing home directly from a hospital, or if you need to go in a nursing home directly as a Medicaid patient, Medicaid can place you in a nursing home within a 50-mile radius from your home. And so, if you have some assets that you can use for a long-term care facility, that goes a lot farther in order for you to be able to find a place that you like, get yourself on a list, or miraculously, although, I'm not accusing anyone of doing this, they should not be able to discriminate based on assets or lack thereof. But in some cases, it's amazing when you got some private assets to use for your own care in a nursing home. You'd be surprised the opportunities you have compared to being on Medicaid right away, because maybe you have no assets. Okay, 3 reminders real quick. One is enroll in Medicare on time, right? Don't get caught with a penalty that you will have for the rest of your life. Okay, so make sure, if you're not sure, make sure you call Medicare, get somebody on the phone. I know it's frustrating, but certainly, getting somebody to avoid that penalty is crucial. Shop carefully for private insurance to go with Medicare. Like Seth said before, we have clients that shop around their policies, especially during open enrollment each year between October 15th and December 7th. See what people are offering. See what the options are that you have. But make sure that you shop carefully during this period of time during open enrollment. And plan for higher healthcare costs in retirement, right? They're not going to get cheaper. And healthcare costs, guess what? They have their own inflation rate. Doesn't matter what the economies typically are growing at. Healthcare costs go up sometimes exponentially. And as you get older, you're going to need more and more care, if anything. So, make sure that you plan for those higher care costs. Okay, if there's anything that we can do for you during this open enrollment period, please don't hesitate to give us a call. Our phone number is right there, 226-1200. You can email me at dmurphy@murphywealth.com, or you can go to our website, murphywealth.com as well, and request an appointment through there as well. So this is an important period of time. This is your chance to do it over again. We think you definitely should take advantage of it, and we hope you enjoyed the information. Thanks for being with us.
Thank you, everybody. Once again, Murphy Wealth Management Group. You can contact us 845-226-1200. And if you have any questions, please reach out. Take care and good luck in your enrollment period.
Enjoy your fall.